Hi, this is Dr. Girish A.C, consultant plastic and cosmetic surgeon. I am heading the Curls and Curves Cosmetic Surgery Center, Vijayanagara, Bangalore. Today, I am discussing about liposuction and its management. I'll also demonstrate how the liposuction will be done. So, the liposuction is a cosmetic procedure to remove the excess and unwanted fat from any part of the body. So, from head to toe. So that all the external fat can be removed by liposuction. The regions, for example, it can be in the face, double chin, upper back, arms, chest area, lateral chest area, the abdomen, tummy is the usual common area, hips or flanks, then buttocks, thighs, calves. So like this, whatever the external fat, unwanted and excess is there, so we can remove that to give them a normal contour. So all the aim of the liposuction is to give them a contour rather than weight loss. But of course, weight loss will be, weight loss will happen which is proportional to the amount of fat what we remove. So then let us discuss about the think about this obesity, how it happens and all. Obesity, basically the root cause is hereditary or genetic. So which is supported by the only the in the family only the selected parts are will become obese, like maybe the hips, buttocks, or the tummy area, or thighs area, or saddlebags, what we call. So or only with the arms also. Means it can be the fat deposition can be in the selected area, selective areas, or it can be generalized. So this obesity can start either early in the childhood or in the later part of the life, maybe around in the youth, according to the genetic destiny. Genetic destiny means the which parts to involve, how much to expand is genetically destined, and when to happen, everything is genetically destined. Accordingly, this obesity happens. So hereditary or genetic is a main factor. Apart from that, extra calories means over than what we require to spend or activities. So the extra calories will deposit somewhere in the body, maybe in the tummy area, thighs or buttocks area, or in any other part of the body. So extra calories is a problem. So then the sedentary lifestyle, hormonal imbalance changes, PCOD, post-pregnancy changes. So these are the other contributing factors. So maybe even excess alcohol. Alcohol means also the extra calories only. So these are the causes. So what happens in the obesity? The fat cells will expand instead of increase in the number. So for example, if there are 1000 cells in the abdomen, so the 1000 cells will remain as 1000 only, but it will expand. With the exercise and diet, one can shrink the fat, but one cannot eliminate the fat. But liposuction, what it does is, it removes the fat permanently from a given part. But do we remove everything? No, we leave behind the normal. We remove the excess, means maybe around 80% of the that excess fat we are removing, and we leave behind thin rim of fat for a normal contour. So thereby it does not cause any harm. So since the energy is not stored in the fat, so there is no weakness that can happen post surgery. So then the liposuction is conducted under general anesthesia or under regional anesthesia. So today we have a case of the male person who is having obesity, of the tummy area, flanks area, back, and also the chest area called as gynecomastia. So we are doing entire this chest, abdomen, and the back area. So that concept is 360-degree liposuction. So what we do in liposuction? So we first of all we make a tiny dot holes through which the tumescent fluid, that is a medicated fluid, which we infiltrate to separate the fat cells. So then we do a liposuction through a tiny dot holes of 4 mm or 5 mm. So the technique varies. It can be standard liposuction where the cannulas are used, just only cannulas are used. Of course, so that is a standard one, also called as classical liposuction. So other the technology-based liposuction, which will have definitely a cutting edge over the normal liposuction. There are a lot of advantages with them. So we usually do the laser liposuction, power assisted liposuction. So with this, so nowadays we are able to deliver the high definition or the best contours without any the complications or most minimum or nil, I can say. So this technology is helping us to give them a good contour and better results. So today let us see how the liposuction is done step by step. Today I am going to discuss about the liposuction, the step by step. I'm going to demonstrate it. So I'm going to perform the on a person who is obese, who is around 112 kgs weighing, and he is having the obesity of flanks, hips, and the tummy as well as the chest. That's a gynecomastia. Before that, I would like to show what are the technology we are using here. The first one is the advanced infiltrator. Here what the tumescent fluid is injected before liposuction. This is to disperse the fat cells. This advanced infiltrator, the specialty is it can infiltrate the rapidly or fast for the fluid for the given area. And this is the power assisted liposuction console box. So this is what we use for liposuctioning purpose. So before the liposuction, we use this Vaser machine to disperse the fat, and that makes the and also it shrinks the skin, the fiber septae. So thereby the high definition, the good contour, and will be there. There won't be any loose skin after the liposuction. So now I have made a tiny hole of around 2 mm. So this is 3 mm infiltration cannula. So now I'm going to infiltrate the area. So this will help to disperse the fat cells or liquefy the fat, and this helps in liposuction. After the infiltration, I'll be doing a vasering. Vasering helps to disperse the fat and also helps to shrink the skin fiber septae to achieve the high definition or a good definition. So there won't be any loose skin after the using vasering or vaser machine. So this is the hip area or low back area or the flanks. So first we are treating the low back area or the flanks. This is a 360-degree concept of doing liposuction. That is tummy in the front, sides, that is flanks, and low back area to have a proper and uniform definition. Now the infiltration is over at the back. That's the low back area, complete lower half of the low back. It is completely done. So now we have done the vasering also. After finishing the vasering, so I'm going to do a liposuction using power assisted liposuction. So it's like almost a 2 horsepower, the powerful suction machine what I'm using. So now I'm going to do a liposuction. So liposuction is done in a subcutaneous plane between the skin and the muscle. So we are not harming the muscle here. So we are just removing the unwanted excess fat, leaving behind normal fat and giving a contour to the area. Normal contour. All the concept is from abnormal to normal. You can see the fat coming out through the tube. So through the tube. Now the liposuction at the lower back is over. The usually we confirm with the pinch test. Pinch test is a deconfirmatory test where we feel that fat is empty. So this is an indication where the fat is empty, and this is a normal pinch. That is, little normal fat is left behind and excess fat is been removed. So this is the demonstrating how we have completed our liposuction. Similarly, on this side, you can see that the fat has been emptied thoroughly, leaving behind a normal fat. This is called as like pinch test. Always we do to demonstrate even to the clients, and for ours the confirmation also we do this pinch test. So we are finished at the back, and now we will proceed for the front portion. So now I'm going to start the abdomen liposuction. But before that, so we can do a pinch test to see the difference between before and after on table. So this is a pinch test where the you can hold a chunk of tissue, lot of fat is there. So we can see thus see that it is lot of fat is there. The same pinch will be done later. The same pinch will be done later. Then we can see the what is the difference before and after. So this is a confirmation rather than the inch loss. So it is what we call as pinch loss or pinch how much pinch. So then the finally we will come to just a 2 centimeter pinch. So that is our aim. So he is having lot of fat in the tummy area, the front portion, the flank portion, and also he is also having gynecomastia problem. The huge glands are there, but this we are doing later. First we are finishing the abdomen liposuction. To begin with, we infiltrate the abdominal area with the tumescent fluid. We are infiltrating the abdomen with tumescent fluid. This fluid will help to separate the fat or liquefy the fat, and after that we will do a vasoring, VASCR, vaser. It is not laser, but laser is one of the technology. Vaser is one, it is also called as ultrasonic liposuction. So that it vibrates and separates the fat. So thereby the suctioning becomes easier. We do suctioning with the power assisted liposuction later. So this is a 3-step procedure. First is infiltration, then vasoring with the vaser machine, that is called ultrasonic machine, and after that we do liposuction with the power assisted. This is a 3-step procedure. So finally we get the results. So it is considered as a daycare surgery. Either we do it under general anesthesia or regional anesthesia. Regional anesthesia means either spinal anesthesia or epidural anesthesia. We do not prefer to do it under the local anesthesia because a lot of local anesthesia has to be infiltrated, and it can be a toxic dosage for the client. So and the pain will be there while during injecting the local anesthesia. For those reasons, and so once there is a pain, so we cannot do a proper job of liposuction. So thereby at least myself do not prefer to do it any liposuction under local anesthesia. So always under general anesthesia or regional anesthesia, which is a complete anesthesia. There is no pain. So thereby we can do the best job. We can do a proper liposuction technically and achieve the required results. Now we have finished our infiltration for whole entire abdomen and flanks together. After that, the even infiltration is made through the tiny holes which are in the hidden area or low-lying area. So for example, the one hole was made here and we have infiltrated the entire on the right half of the abdomen. Similarly, another hole was made on this side, and the entire the left half of the abdomen was infiltrated through that hole. So now the liposuction will be done through such tiny holes which are very low lying. Maybe 1 or 2 additional holes will be made, which are around 4 mm to 5 mm in nature. And if required, we make one hole in the umbilicus, and in the upper chest region, that is also hidden area, and if required only we make one or two holes on the sides. So thereby, first of all, these holes are 4 to 5 mm in nature, and it is kept in the hidden area. It heals very well. So the one need not worry about the scars about the whatever the tiny holes we make. It heals very well. After the infiltration now, we are starting with the liposuction using a 5 mm cannula, using the power assisted liposuction. So now we have already finished the vasoring. Vasoring is done. Vasoring is to disperse the fat cells. After that, liposuction is done through power assisted liposuction. The ultrasonic machine, the vaser, does not will not do a suctioning job. The suction has to be done either standard liposuction, that is called as mechanical liposuction, or through this advanced technology that is called as power assisted liposuction. So this is one which helps us to clear the fat very well and achieve the contour very well. You can see the fat flowing through the tube, the suctioning. So the fat comes as yellow fluid, clear, and it is getting emptied. So once I finish the liposuction, I will demonstrate the pinch test later. Always the weight loss will be proportional to the amount of fat removed. If we see in terms of liters, if we remove roughly around 10 liters of fat, so then the 5 kgs or 6 kgs of weight loss will be appreciated. But main aim of the liposuction is contouring rather than weight loss. But weight loss is always a bonus. Weight loss will be there. Now you can see the clear fat which is flowing through the jar, suction jar. This is a powerful suction of 2 horsepower, 2 HP, an advanced suction machine. Now the liposuction procedure is over. The abdominal liposuction is over. So now what is the end result? How we confirm that we have done a proper liposuction? It is confirmed by pinch test. So this is the normal fat thickness of 2 centimeter thickness. So the uniform thickness is there everywhere. So if we compare the both sides, it is same. So if we compare the both sides, it is the same. So on the sides, anywhere in the upper abdomen, on the both sides, so in all the parts of in all the quadrants of the abdomen, so the thorough fat removal has happened. So it is tested by even over the chest, that is the over the ribs. So even we have removed the fat. So which is evident by the pinch test. So which is uniformly reduced on and equal on both sides. So this is one confirmation, and after the procedure we show the contour achieved, so pinch test photographs, and also whatever the fat removed will be shown at the end. And this is a permanent solution. This will remain for lifetime. Along with if they maintain the normal the lifestyle or healthy lifestyle, that is normal diet and the or a balanced diet, along with the 30 minutes of activities or exercise, will maintain the whatever the results achieved for lifetime. So now I'm going to show you the fat. So this tub contains around 12 to 13 liters of fat that is removed from abdomen and hips and the lower back. This the overall weight loss will be half of it, maybe roughly around 6 to 7 kgs of weight loss will be there, which will be appreciated at the end of 2 to 3 months once the swelling edema settles down. There will be some leak through the tiny holes for 1 or 2 days. We put a waterproof, we put the absorbable pads, dressing, and put abdominal belt for him. So we can discharge him same day evening, and he will resume normal food from today evening itself. And maybe he will take 1 or 2 days of some rest at home. We will advise him to come back after 3 days. So by the time the leak will stop, then we put waterproof plaster for these tiny holes. After that, he can resume routine activities. He will come back after 10 days for the removal of these waterproof plasters. Then we advise him to do some massage. The massage will help to reduce the swelling, hardness happening there, and also some sensory temporary disturbances will be there, which all these things will recover in 1 or 2 months of time. So more or less, he will have very normal, natural contour by the end of 2 to 3 months, and which will stay for lifetime, coupled with the healthy lifestyle. So this liposuction can give a permanent results for obesity.